I am Dr. Muralidhar. Now, in this video, let us know a little about varicose veins. Now, what are varicose veins? Varicose veins are nothing but dilated, they become tortuous veins, mostly in the leg. And then, why a human develops varicose veins? It is not seen in the animals because humans have assumed an erect posture. Now, our animals were walking on four legs, where the humans are walking only on two legs, and because of this, the blood which is in the legs or the lower limbs to flow back into the heart is a big task. So, for that, the God has given a mechanism, that is the muscular actions in the foot or in the leg or in the thigh. They push the blood against the gravity towards the heart, and then whatever the blood that is flowing into the leg is going back into the heart. So this mechanism is very important, we should know. And how this mechanism efficiently works: when the person is walking, when the person is moving the leg, or when the person is exercising, so the blood which has to flow in the veins depends on these muscle action. So now, when a person is not moving much, or when he is obese, or when he is constantly sitting and then doing some job, then the flow of blood within these veins is not happening properly. So, in such situations, the veins, when they collect blood, they tend to enlarge, they tend to dilate, and they are called as varicose veins. Now, for developing these varicose veins, there is another factor which may contribute, is the hereditary factor or the genetic factor. Means the veins genetically are weak. The whatever the wall of the veins have to contain muscles, these muscles are little weak in some of these persons, and so they tend to dilate and they become big, and hence these varicose veins are developed. Now, what happens if the veins become big? See, one more mechanism we have to understand is that the God has given valves within these veins, and these valves, they go away when the veins become big, and when the valves go away, they become incompetent, so they don't prevent the backflow of blood. Now, when the valves are competent, the backflow is prevented and the muscle action keeps the blood go towards the heart against the gravity. But when the valves become incompetent, the veins are enlarged, then there is no proper flow of blood. So, this the by definition, varicose vein means dilated and tortuous veins with incompetent valves. Now, in the thigh, majority of the blood is collected by two systems. One is the great saphenous system, another one is a short saphenous system. And they all collect this blood and put it into the deep veins near the groin. When these blood go into the groin, there is a valve which prevents backflow of blood from the deep veins into the superficial veins of the leg. But when these valves become incompetent, a huge amount of blood comes into the thigh and leg, and because of this, the veins cannot tolerate the pressure, because that so much of blood is coming into them, and so they dilate. And when they dilate, you can see those veins in the leg which are pretty ugly, and also they cause a lot of problems like pain in the legs or pain in the muscles. And sometimes, because the flow is not adequate, these veins can have clotting of blood, and this is what we call as thrombophlebitis. And so when the veins are enlarged, people come and ask us, when I have dilated veins, so can I use a stocking, a compression stocking, so that that gets compressed, and we can avoid further treatment or surgery? No, only wearing a stocking will not cure the blood vessels, varicose veins, because the huge amount of blood which is coming into the veins which are below the skin will definitely not be compressed. And so, first we have to assess the patient whether they have any junctional incompetence near the groin or behind the knee, and if they have to be subjected for some procedure, and then wearing a stocking will help them. Now, what are the various types of treatments which are available for varicose veins? Earlier, we used to do classical surgery of avoiding this reflux by ligating the vein and by removing the varicose veins. But now, that being a very big surgery, now we have started using lasers, radiofrequency, or foam therapy to make these veins clot. So the dilated veins can be made to clot, and then slowly they disappear. And then using these techniques, because they are all day care techniques, so that we can just take the patient for procedure in the morning and we can send the patient back home the same day. While a surgery, we have to keep the patient for 2 to 3 days, and also for surgery we need to employ an anesthesia like a spinal anesthesia or general anesthesia, whereas these laser or radio frequency techniques can be employed using local anesthesia, so the patient can be awake and patient can have food immediately after the procedure, and the same day we can discharge the patient. So these methods have become a boon for all these varicose vein patients, and of course wearing a stocking at least for a year after the procedure helps the patients very much, because they don't develop secondary varicose veins. So it is important for them to know a few things like wearing a stocking, especially during day. They can remove it during night and keep the limb elevated. If a person is obese, very important that they have to reduce in body weight and they have to be slim. Otherwise, they will tend to develop more varicose veins even after a procedure. And then, of course, active life, don't resort to sedentary life, and exercise regularly is very important to prevent varicose.